My name is Katie Hodges and this is Dr. Jonathan Chappell, and today I will be interviewing him on injury prevention and things to do to prevent female athletes from getting ACL tears. The first question is, why do female athletes experience more injuries, especially with the knee?
So we know that ACL injuries, which are fairly common overall in both males and females, but they're much more common in female athletes than male athletes. So the question really is why, and there are some factors that we think that are related to the anatomy. Women have different anatomy than men. One factor is that they have a little bit wider pelvis, and therefore their knees tend to drift inward, or a little bit more knock-kneed. We think that's one factor. There's also some people who think that the area around the ACL and the bone is smaller in women than in men, and that might predispose to an ACL injury. There's some who feel that there's the hormonal variation, so that women have different higher levels of estrogen, obviously, and that increased level of estrogen makes their joints a little looser, which makes them more likely to tear their ACL. So the interesting point is that the most ACL injuries occur from what we call a non-contact mechanism, meaning that there's no contact between the athletes at the time of surgery. It's usually just a land, a plant, or a cut. And women can be up to 8 times as likely as men to tear their ACL. Now, we're finding that it depends on the sport, it depends on the level of competitiveness. So in the higher level, like players who play on national teams or professionally, the levels are more like 2 to 1 and not 8 to 1. But at the recreational level, it's often 6 times or 8 times as likely as men.
The second question is, what are the symptoms of an ACL tear?
So when you tear your ACL, what normally happens is the athlete usually stops and cuts or lands and plants their foot, and the leg tends to keep moving. So people will describe this feeling of the leg doing this, the sensation of instability. And so there's usually a pop, but not always. And usually there's substantial swelling, but not always. Usually the knee will swell fairly rapidly, unlike other injuries in the knee where they swell up over a period of 24 to 48 hours. These swell up over the first 20 minutes. And also athletes are very rarely able to fully put weight on it, unlike other injuries. So usually there's an inability to fully put weight on it, substantial swelling, and then pain associated with that swelling. Over the course of 3 to 4 weeks, that swelling goes down, the motion improves, and then the major complaint is more of a feeling of instability. So when you have a knee that has no ACL because it's torn, the athletes, as they go back to playing sports, will feel like the knee is buckling or giving way on them, and you get this feeling of the bones shifting around.
Okay, the third question is, what types of treatment are there for ACL injuries?
So the ACL is a ligament in the middle of the knee that is important for stability. You can live a normal, functional life without an ACL as long as you don't want to get back to playing sports that involve cutting or shifting. So if you want to ride a bike or just walking or do elliptical, you don't have to have an ACL to do that. But if you want to get back to doing more active things, then the ACL is really important. So there are a small subset of patients who we treat non-operatively, and we just strengthen the muscles around the leg, around the knee. But the vast majority of young people who are active, we need to create a new ACL. And you can't just go in and sew the ends of the ACL back together. So I'll show you on an MRI here. And this is an MRI showing an ACL tear. So this is the bone here, the thigh bone. Here's the leg bone. So the ACL, when it tears, it should be nice fibers running up and down like this. With an ACL tear, you have some fibers here and some fibers there, so they basically sort of explodes. And so you can't go in and sew them back together. So what you have to do is something called a reconstruction, and basically make a new ACL by taking tissue from somewhere else in the body and creating a new ACL. So that's typically in young active patients how we treat ACL tears.
Why is the recovery time so lengthy after ACL reconstruction?
So the ACL we're taking tissue from somewhere else and making a new ACL. So it takes a period of time for that tissue to incorporate into the body. So the typical recovery time is about 9 months to 12 months. Every year we try to move that forward and shift it to 7 months or 6 months, and we're all familiar with certain cases, mainly professional athletes, who have been able to get back to sports, example being Adrian Peterson at 4 to 5 months. There are exceptions, but as a general rule, it takes time for that graft to mature. So if you go back too quickly, that will often stress the graft and cause it to re-rupture. So we like to wait about 7, 8, 9 months to get back on the field before we put any stress on that graft. And the other thing you have to remember is all these muscles have not really been used. And you can try to simulate a sport and the activities in a sport in physical therapy and in a controlled environment, but nothing will replicate a game like a game itself. So even players who come back from ACLs even a year to a year and a half out from their surgery will still feel there's a little bit difference. Maybe a little bit slower, not quite as quick. So it does take quite a while to recover, sometimes up to a year or two.
What should female athletes do to prevent these knee injuries?
So that's the million-dollar question. As of right now, we know that women are more likely than men to have an ACL injury. Some of those factors we can't control. We can't control the way that a female is made. We can't control the hormone levels in females compared to men. But we do know there's also differences in the movement patterns. We're finding that women move slightly differently than men. At the more professional levels or higher levels of play, those variances in movement patterns are actually small. They actually move very similarly, and that might be why the prevalence in ACLs is not quite as high in the females as compared to a more recreational athlete. So we think that if we can improve the movement patterns and improve the training, that we can therefore lower the likelihood of having ACL injuries. So that is now the focus of most of medicine and sports medicine, to try to come up with exercises that will then train people to move differently, specifically women, to try to lower the risk of injury. So from that, we have created programs, and there are multiple programs. There are probably 3 or 4 that are commonly used. Some are programs with just a few exercises, which are designed to be done as part of a warm-up. And then there's some that are more time-intensive with 20, 30 exercises that could take an hour and a half, which are designed more for the off-season. So at this point, we are still exploring how effective those programs are, and those studies are underway, and they'll take some time. But in general, the results have been very good. One other thing to always think about is fatigue. So we know that fatigue can play a role in injury. The more a tired athlete is more susceptible to injury. So we always look at that and try to control our fitness, and particularly with muscles around the knee like the hamstring. So that can also play a role.